Emphysema is a very severe disease which is affecting a number of patients in daily clinical practice.
They can't do simple things in their life such as washing, dressing, going to the bathroom.
Everything becomes a burden.
The quality of life in emphysema is even worse than the quality of life of patients with end-stage lung cancer.
It is a condition that needs new treatments.
They're really exciting times right now with the endobronchial valve therapy.
We can achieve in many patients the same clinical benefits that have been shown with surgical volume reduction.
So the big advantage of the valves compared to the other endoscopic technologies we have nowadays is the evidence.
The evidence is really accumulating that this is really a powerful treatment for emphysema patients.
There is a huge evidence building with clinical trials that show that these valves, when used properly, are very, very successful.
We've achieved tremendous success in trying to identify our best responders.
First thing we've learned was that if you choose patients without collateral ventilation, you're going to improve the outcomes.
Well, the introduction of CHART has really made the therapy even more robust.
So within 10 minutes I can place the valves in a really well-selected patient.
We can reposition the valves if need be. We can put additional valves if need be.
With the valves we have the only technology available which is really reversible.
The majority of patients, once they have been introduced with the potential side effects or complications associated with the treatment, they still choose moving ahead for getting treated.
And the risks are that of a pneumothorax.
If that happens, we are the experts. We can handle that situation for you.
This patient was very breathless to start with, and we were doing these patients as day cases in those days. And when the patient came back to me a month later, he was just crying in clinic. And the reason why he was crying is he was just so transformed in terms of his life.
But these patients cannot do anything anymore. And you apply a treatment and a month later they're really a different person.
With successful endobronchial valve therapy, we are able not only to achieve palliation, but also for some of the patients, and there's early evidence for that, actually improve overall survival.
You really can change a patient's life when you apply these therapies to your patients.